all to attending our meeting today about the introduction to the fellowship program from the World Kidney Academy. And we are happy to have Dr. Prof. Ahmed Halawa. He's a consultant transplant surgeon and the director of the World Kidney Academy. He will give us a brief introduction about the follow-up program in clinical transplantation and the eligibility, the structure of the program, and who is eligible for that. Also, the clinical orientation for this program, plus who is eligible for this program and the accreditation of this program. So, Dr. Ahmed Halawa, the floor is yours.
Thank you very much, Dr. Saja, for this nice introduction. Actually, you should give this talk, you and Dr. Ahmed Arif, because both of you have been with me for the last 2 years. So the nitty-gritty of this program very well, better than mine. Anyway, the World Kidney Academy basically is educational forum, is designed for you. It's online fellowship in clinical transplantation, World Kidney Academy, accredited by European Accreditation Council of Continuing Medical Education. More than 750 students or candidates or fellows or colleagues from 32 countries enrolled. Tutors from 13 countries being involved in this education. So big number of tutors, big number of colleagues from everywhere, and level of colleagues from just beginners to very senior, like both of you. And this is accreditation certificate. We're always keen to get accreditation, otherwise it would be waste of time. And I will explain shortly why it's important to have accreditation in addition to the knowledge. The whole idea of doing any degree is to improve the employability. So the degree has to be designed to improve your employability. How to get employed? You need 2 things: certificate, and most important is the knowledge. I will tell you, I'm sure you know some stories where highly qualified colleagues join a job and we discover later on they know nothing. They're being kicked out of the job or they were not promoted. What was missing here is the knowledge. So the degree itself, the paper itself, is not enough. Disclaimer, I have no conflict of interest. I'm not looking for a position. I'm not looking for award or any personal gains. I have the intellectual property of the successfully implemented online education and transplantation, and all the suggested ideas are entirely mine. This fellowship was an extension of the master degree in transplantation by University of Liverpool, which is recently stopped, I think a year or 2 years ago because of lack of funding. The University of Liverpool decided to go mad, ask for more fees, more money, and also they put obstacles in the form, you have to have English exam test. At the beginning, like what Tariq did and Ahmed Arif, there was no English test, but they sailed through the degree nicely. But simply, this is typical of British bureaucracy. When they see something successful, and instead of promoting it, they try to, they think they are regulating it, but they are not. They are not. Anyway, this is a lot user-friendly compared to your Liverpool course, number one. Number two, is a lot cheaper as well, because before we stopped the program, they charged 1,400 sterling, British pounds per module. And this was not affordable by many of our colleagues. So we decided just to do something affordable with high quality as well. The objective of this talk, we need to learn from COVID. I think COVID gave us a hard time when we have to do a lot of things online. Clinics be run online, education run online. The only thing which couldn't run online is operating. So the COVID minimized our doctor to patient contact. And we realized that everything works well online. Not perfect, but much better than nothing at all. I would like to explain the learning objective of this course, the need of this program, and the market and the marketing. Basically, we need to get the balance right. Many of the colleagues, busy at work, busy with the family, have no time to learn. They have no time to attend didactic lectures, which have fixed time and fixed place. They cannot take time off. So the online teaching, online education will get into them, will be available at their own fingertips rather than get dressed, catch the bus or drive to the university and get the lecture and then go back again. These days, it's quite difficult. The objective is critical thinking rather than bottle feeding. We try to push our colleagues to think, look for the knowledge, look for, for the science, and present it to us rather than spoon feeding. The program teaches professional skills like transplantation because it's clinically oriented. As I mentioned early on, employability skills, problem-solving exercises, resource management, because we'll ask the candidate, for example, if it is going to treat somebody who's, let us say, induction therapy for highly sensitized patient using Campath. Do you have Campath? No. Fine. So why you suggested to give Campath if you don't have it? So what do you have? ETG. So why not use the ETG then? It's a lot cheaper compared to Campath. Basiliximab sometimes is not available in underdeveloped countries. So you can transplant without even induction, but you have to be very careful. You have to bypass these obstacles by having low-risk transplant, make sure the cold ischemia time is short. So this is called resource management. Use your resources as much as you can and get the best outcome out of it. Academic skills, publication skills, presentation skills, critical appraisal, you will learn this from all programs of the World Kidney Academy. This is our obligations towards the community to learn in order to give the right advice to our patients. The program consists of 6 modules, cost, as I mentioned, $360 per module, but because there is MOU, Memorandum of Understanding, with the Albani Society of Nephrology and Transplantation, so there you get subsidy of 25%. Look, challenging culture of poor education habit. This is what we do. Colleagues sometimes copy and paste from others. We pick them up and hammer them hard. Copyright, respect, academic integrity, all these are not well taught in our countries. We implement academic integrity policy and respect of copyright as well. Dealing with mature clinicians, believe me, is quite difficult because mature clinicians, including myself, have bad habits. As if you are taming a crocodile. You will never get a crocodile as a pet. What to teach? Knowledge, knows how, which is the explanation of the knowledge, the basic of this knowledge, the principle of this knowledge, where this knowledge coming from, and shows how to use it. If you see, this is called Miller triangle, and this is what we teach. Knows how, shows how. So basically, the cognition and half of the behavior will leave the performance to your clinical judgment and your clinical setting. The question is, for clinicians like us, mature clinicians, do you need bedside teaching? Do you need to auscultate the heart to listen to a murmur? Do you need to examine the scrotum for hernias? Do you need to palpate the abdomen for enlarged liver or enlarged spleen? Of course not these days, because radiology is very advanced. Number one. Number two, if you haven't learned this during your undergraduate teaching, it will be completely waste of time to join us, because you already know this. We're not rehearsing and reimposing all these clinical skills back again, because you should know it. Online attracts doctor busy at work, busy with the family, cannot take time off, is anytime, anywhere. So whenever you have free time, you come and join us and learn with us. Cost is a lot cheaper. The online education crosses the border without visa. No cost for travel. The same applies for tutors as well. So I live in UK and teach in Oman. Definitely attracts more doctors compared to didactic face-to-face teaching. Also, it's high standard of education because the media has been lent and the technology been lent good enough to deliver high quality education while you're at home having a cup of tea in one hand, bag of crisp in the other hand, watching the telly, and while you are in your pajama. Why the academy? Because external accountability, attractive, more doctors expand the market, but it's a pain in the backside because accreditation and the academy is monitored by the accreditation bodies. In order to get accreditation, you have to give them username and password and join us and see what we are teaching and evaluate the material very well. The teamwork. And who is teaching? Clinicians from reputable transplant centers, transplant surgeons, transplant nephrologists, transplant coordinators, nurses, immunologists, radiologists, even colleagues joining the course as well. With being online, so it's open 24/7. Whenever you have time, you can join in and learn. Communication through many tools: Facebook, mobile, email, SMS, Viper. How? So what are the components? What are we teaching? Online lectures, fine. But, you know, if you join the YouTube, you find plenty of lectures free. Is it all about a lecture? No, it's all about the interaction between you and the experts. Through online case studies, problem-solving exercises, journal club MCQs. And this is where the interaction between you and the tutors. We have massive e-library for suggested readings. There are two forms of assessment. The formative assessment through your contribution to the clinical scenarios, critical appraisal of scientific papers, and the MCQ, and formative assessment recently changed from written assignment to MCQ exams. You need to contribute by 70% because the system will count the percentage of your contribution, and you need to achieve more than 60% of the MCQs. Otherwise, you won't be successful. If you were unsuccessful, you have to retake the exam again. Student-led and self-directed learning. So actually, if you see it, we learn from you. And we learn from each other. You could provide an evidence which I haven't read before, so I learn from it. Your colleagues will learn from it. This is why we ask all the time to reference your contribution, to cross-check, make sure the reference is valid. As you see, students will reply to each other rather than opening a separate discussion. Many of you managed to write review articles and meta-analysis. We help colleagues if they have presentation. And also, we ask distinguished colleagues to give lectures on the course. In addition to our standard tutors-led teaching. For the tutors, we don't let the tutor to give you the information and the answer easily. Just to finish it off, no. There's no spoon-feeding teaching at all. The tutor will be involved in the journal club, marking the assignments. The discussion board is run by 4 tutors. So every day you will have a different one. And we are always there monitoring the performance of tutors and students. Updating the course, how do we update it? It's dynamic. If we find a new article or something interesting coming up or came up recently, we'll upload it and we'll discuss it. The clinical scenarios as well will be updated regularly. New guidelines will be supplied as well. Other programs on the World Kidney Academy like glomerulonephritis, critical care nephrology, deceased donor transplantation workshop, fellowship in clinical research, and program fellowship in hypertension. Eligibility, doctors and allied healthcare professionals. Doctors or any other related subspecialties. Pharmacists, they can join, especially if they deal with the renal pharmacy. Transplant immunologists, transplant coordinators, all of them welcome to join. The market, no similar clinical online. This is the first clinical online program in transplantation in this part of the world and even in Europe. Challenges, online teaching is ideal for postgraduate doctors and allied healthcare professionals who are busy at work. Online teaching can provide a high-quality education. Online degree from credible institution are well respected. We have few doctors who applied to UK jobs after joining the programs, one of the of our programs, and is counted towards their application. Benefits: students, high quality education, cheaper cost, emerging centers, promote them and support them, organization control of your education. You'll be in control of your teaching. There's always option for second opinion. And this is our contact. Of course, this is my email address on the World Kidney Academy. So let's do it together, and thank you. Now, I'm going to take you through the platform itself. Hopefully the internet will help. Leave this one. And this is actually the front page of the World Kidney Academy. As you see, there are many programs, and all of them are very busy programs. And these two programs are coming soon. Renal replacement therapy and one for allied healthcare professionals. So let me log in first. So I will take you through module 6, which is the latest module we have done together. So Fellowship in Clinical Transplantation, Module 6, Complementary Clinical Practice in Transplantation. So this is here, the description of the module, module staff, module leaders, it's me, module overview, files. These are free, plasma exchange in kidney transplantation. Basically, we allow colleagues to download the lectures, but as PDF files. And academic and supporting resources, introduction to critical appraisal of original article, plagiarism and research dishonesty, part 1 and part 2, presentation skills, writing in science, and these are 2 books here. On writing well, the elements of style, find it here. If you go to the curriculum, there are weeks, 10 weeks each module, and 2 assignments, final assignments. This is because of the module. At the end, you have to get 2 assignments. So let us look at this lecture. Of course, this face is familiar to you.
Good morning, everybody. I am May Hassaballah, Professor of Internal Medicine and Nephrology, Cairo University, and the President of the Egyptian Society of Nephrology and Transplantation. And I would like to share with you a very important and interesting subject, which is plasmapheresis in kidney transplantation. So I'm going to share my screen now. Okay. Now, well, the agenda will include definition, history, principle, technique, and then we're going to speak about the indications in kidney transplantation. So the word apheresis means to take away. So when you selectively take away something from the blood, and this is either from a donor or a patient, this is apheresis. And when you use this for treatment, it is called therapeutic apheresis. Whereas if you take away the plasma and you give substitution fluid for exchange, this is called plasma exchange or plasmapheresis. Well, for the history, it was first described in a dog in 1914. Then it took many years until it was performed in patients with macroglobulinemia. And again, 15 more years, it was used in Goodpasture syndrome. And then 1 year treated lupus, another year PCP, and it became widely spread. The principle of plasma exchange is removal of large molecular weight pathogens that could be immunoglobulins, immune complexes, cryoglobulins, light chain proteins, maybe endotoxins, toxins. You can also have cholesterol-containing lipoproteins, and also substitution of necessary or deficient substance.
So basically, this is the lecture, as you see, is audio lecture. So something to listen to. Scenarios. So let's just see the scenarios and how they get evaluated. So a clinical scenario, a 26-year-old lady was transplanted 2 years ago. Her current serum creatinine 201 micromole per liter. She has stable proteinuria for nearly 1 year, 1 gram per day, following 2 attacks of rejections, which were treated successfully. She is not hypertensive. Her current immunosuppression medications are tacrolimus, 3 milligram BED, MMF, 500 milligram BED, and 5 milligram prednisolone. Counsel this lady regarding contraception, pregnancy, and lactation. It's not an uncommon scenario that young ladies in the childbearing period, they're naturally interested to become mothers. But meanwhile, you have to give them advice, the right advice, and let them take the right decision for them. So you'll see colleagues will reply to counseling because, we left the program open, because all these, they didn't contribute to, they did not reach the 70%. And then after day or two watching them, we start to contribute as tutors. So clinical scenarios is we are learning together in a blended form. We read your reply, you read the other's reply, look for the right answer, and put it down in writing. So the clinical scenarios are different, addressing each one, address one objective, one learning objective. So we try to make it simple and focused on one learning objectives. So what's your protocol for EGG induction? How do they influence the maintenance immunosuppression? So basically, we need to know whether do you use EGG properly, right or not. Do you use it through central line or peripheral line? So if you run out of access and no internal jugular veins and subclavian are already thrombosed and you have a fistula, will you use it through the fistula or not? What are the pre-medications you're going to give? What's your cutoff level? When do you stop the ATG? Just a reminder, فذكر لعل الذكرى تنفع المؤمنين. And we'll let you to comment and we'll read it and then reply. Similar scenarios like this. Let's just see the journal club, because journal club is just similar to the scenario, but the good thing about the journal club, we allow you to download the paper and read it. So if you click here, view and download, you can download the article. And usually journal club is related to the lecture. And you start replying. As you see, 135 comments on the journal club. Watch you, we'll make a comment. And actually, if you see here, actually we're breaking down the journal club into questions because we don't like you to dive into a deep sea of uncertainty. So just a few points we need you to summarize regarding this article rather than the whole article. Then we'll come to the MCQ. As you see, the platform is user-friendly. So MCQ week 4, there is no interference from the tutors here. It's all automated. Start the quiz. You answer. Like this. I'm just, without reading them, what do you think about this? This patient on cyclosporin. What's your diagnosis? Any answer? Excellent.
Chronic CNI toxicity.
Yeah. Striped interstitial fibrosis. Yeah. Yeah. Because we don't see it quite often. So submit the quiz. Okay. Oh, I got 20%. Oh. Because I'm marketing haphazardly. Look here, you will get explanation. This is wrong. The red one, the green one is right. However, I didn't read any of them. And explains the answers. We give you explanation of the answer. Then at the end, we'll give you 2 MCQs, MCQ exams. Again, automated. This is at the end of the module. And actually, after you first attempt, we'll give you the answer. We're not planning, we're not interested to fail you, but we are interested to teach you. And this is a real exam. Look, even myself, honestly, in spite, I'm the one who designed the questions. I got only 80% in this one. it must be too harsh to the extent that I didn't achieve 100%. We're not interested you to achieve 100%, but at least get the pass mark. 92% in this one as well. So you answer the question, you get the answer, you get the feedback. This is all about the fellowship in clinical transplantation. I'm open for question. Feel free, please.
Thank you, Prof. Ahmed. Very informative presentation. Actually, I personally went through this program, and alhamdulillah, I completed the 6 modules, and I found it very informative, very useful, helped me a lot in my career. Despite I'm board certified since long time, but it is like designed in a very well structure that help each physician in daily practice. It helps us also to improve our decision making in challenging cases. So I found it very interesting, and I enjoyed all these modules, despite it need time management. Really, it should be like make it as a joy, and be careful about time management, and be involved in every week discussion, group discussion. You should be involved, not keep it to the end. And I would encourage everyone, not only like, maybe we are working in institute with mainly transplant work, but I would encourage everyone, even those who are working in dialysis service. I think it is still informative, because the structure of this program, it designed to help everyone, and it will be exposed to every details in the nephrology, from dialysis, from even pediatric nephrology, adult nephrology, drugs, immunology, pathology. So it is very dense program. This is my opinion.
Yeah, it's over 2 years.
And we will share opinion of others, and Prof. Isa, maybe he's still with us.
Thank you, Saja, Dr. Ahmed. It is very important. I think it's not only, it might help in promotion, not only in Oman, but regionally, internationally, but as well, it's really add to an individual experience and education, and just possibly as well adding to update in this field. And I think possibly everyone may join, inshallah. And we encourage everyone to help, especially the younger staff.
Thank you, Professor Isa. Basically, you can join anytime. I mean, if not necessarily to wait for the lectures to be deployed and on display. No, you can. We deliver the material every Saturday morning, and the next material will be next Saturday. So we have plenty of time to join during the week and read and contribute. So it's very flexible, designed for busy doctor like all of us, actually. So on calls, busy with everything, day-to-day life. Any more questions? Ahmed Arif, do you want to make any comments?
Thank you, Dr. Ahmed, and thank you, Dr. Isa, for your encouragement. My personal experience in this fellowship program, it was a very nice experience. Even if we are working or we have previous training and teaching in the field of transplantation, I feel it is enough to provide an updated data that I will feel confidence that I'm providing the latest updated guidelines in managing my patients. It provide a flexible way of study. I don't have to change my routine on call duty to attend my lectures or to attend the journal club. So it was a very nice, informative, and impressive educational experience. I enjoyed it very much.
Thank you, Dr. Ahmed. Any more question from colleagues?
دكتور احمد اخبار حضرتك ايه؟
اهلا
معاك رامي.
اهلا
صح.
دكتور. اهلا بيك
اخبارك يا
بيك.
فندم؟ عامل ايه الاخبار؟ دكتور عيسى اخبار حضرتك يا فندم؟ انا بس برضو كان ليا كومنت لو تسمحوا لي بعد. يعني I was working in transplantation since I think 7 to 8 years, and I joined this fellowship once it started, and it was a transitional point for me, to be honest. Yeah. Some of our practice is not based on knowledge, and once I joined this fellowship, more point become more clear for me, and even for updates. هو دايما المشكله عندنا ان هو لما بينزل recent upgrades او نزل updates في الترانسبلانتيشن مش بنقدر نوصل له بسهوله. فبصراحه الدكتور احمد حلاوه والفيلوشيب سيمينارز بالدسكشن كان بيقدر يابديت اس بكل الجديد. فهي للامانه الفيلوشيب نقله نوعيه في اي حد هيجوين ليها يعني. ف يعني انا حتى والله بفكر ان انا افضل طول الوقت معاهم ان شاء الله، وافضل طول الوقت موجود في الفيلوشيب، لان هي العلم ما بينتهيش معاهم يعني. فجزاك الله خير عنا دكتور احمد، وان شاء الله بالتوفيق، وكل الناس ان شاء الله تبقى موجوده معاك مع حضرتك ان شاء الله.
لا شكرا دكتور رامي. دكتور رامي by the way and a very experienced transplant nephrologist, and he has his own forum as well for education. That's right, Facebook. So he's a competitor.
حضرتك استاذنا كلنا والله يا دكتور احمد، يعني جزاك الله خير عنا كلنا يعني.
لا شكرا دكتور رامي، كتر خيرك بشكل عام.
ربنا يخليك.
Anyway, I mean, you have my email, and you can contact Dr. Rami, Dr. Tariq, Prof. Isa, Dr. Saja, Dr. Ahmed Arif, and then if you are interested, we'll start the next batch in June this year. We'll start with transplant immunology from scratch, principle of transplant immunology, then advanced transplant immunology, and we'll take you through the whole curriculum of transplantation. Transplantation is a very volatile, especially the immunology, very volatile subject. It evaporates quickly unless you keep revising it, because updates are massive. Every day we get updates. Transplant immunology, again, this is a deep sea of uncertainty, because unless you keep reading it, unless you keep practicing transplant immunology and reading it, you will never remember what the difference between T cells and B cells. So sophisticated. So next batch, June, inshallah, 2024. Feel free to join us. There's one question here. Please submit your question.
No,
This is Sasha. I don't have any questions.
I think, Prof. Ahmed, you modify the module for there's no more assignments about review article or poster presentation, right?
Yeah, absolutely. Yeah, I mean, this was labor intensive.
So you make it more tough to us before.
Yeah, in at the beginning, actually the first 5 modules were, heavily loaded with assignments in the form of poster presentation, PowerPoint presentation, critical appraisal of scientific papers, and written assignments. Few of the colleagues managed to sail through and did enjoy it, but the others were a nightmare. They didn't have the time to write it, and even the written one was in poor quality. So we have to fail many of them and ask them to resubmit. We decided to to be more American by using MCQs. Everything in the United States is MCQ based. In the UK, is written assignment based, but there's still MCQ as well. We monitor your contribution through the discussion boards and the journal club, and this will give us an idea how good you are, the area of weaknesses you need to improve, and the area of strength you need to promote further. So the MCQ are not labor intensive, automated again, and the system will mark it for you. But the MCQ hit you anywhere. No, if the module is talking about transplant immunology, you will see the MCQ, some of the MCQ on donor assessment, because we don't want you to forget the donor assessment of recipient, cardiac evaluation of renal transplant patients. In spite of the module is talking about immunology, but you see different aspects. So we keep you on your toes all the time. We'll keep you alert and conscious all the time. We don't like you to fall asleep. Any question?
I don't find any questions in the chat box.
Looks like it's very clear, like mud.
Yeah, you are very clear.
Thank you. Fine.
Okay.
Thank you very much for this invitation. And really, I did enjoy talking to you. I did enjoy meeting you. And hopefully we'll see you in Oman or see you in the UK.
Thank you, then.
It will be
Thank
in
you very
June or May, the joining.
June, and we opened the application already. But
Okay.
yeah, but the program will start in June.
Sure.
Inshallah.
Okay, so we will, at the end, we will thank you, all of you. Thank you for the audience. Thank you, Prof. Ahmed. Thank you, Prof. Isa. And see you again, inshallah.
Inshallah.
Thank you, Ahmed. Thank you.
شكرا رئيس.
شكرا جزيلا.